Hi, I'm Dr. OBT. Welcome to Dr. OBT's podcast, and this is part 2 of the Q&A session. So I believe that having a retruded or a short chin or a smaller chin, first of all, get a proper face analysis. So when I have a patient in front of me, from the minute they sit down and I greet them, I start scanning their face because I'm in my work mode, so it's very natural. And I kind of look at them as they're speaking. I ask them to show me their side profile. It's important to actually know how you could improve the patient's facial harmony in order for them to look more attractive and be happy with their appearance and increase their self-confidence. So yes, the chin does play a big role, and I think that females who have such issues should first of all have a proper in-depth consultation and understand the treatment options. Some of the treatment options are facial fillers. Now, fillers should be administered by somebody who is well versed in anatomy, is a doctor, and really has experience in treating such an area, and also using the correct product for this area. So a lot of the times when we see fillers go wrong, it could be due to the product, due to the expertise of the practitioner, it could be due to the product used, it could be because of the technique, and it could also be because it was not done by a doctor. So it's very important for best results that you discuss with your doctor. So in my practice, I use a variety of fillers. Some of them contain hyaluronic acid, some of them contain more bioregenerative or biostimulation material, which are much more longer lasting. And I also do chin implants as well. So it really depends. If you want to go down the filler route, then I think you should go to somebody with experience and who can actually help you harmonize the full face rather than just addressing one area, because that's what facial harmony is all about. Thank you. Yes, mandibular bone reduction is possible, but I would like to involve a maxillofacial surgeon in this procedure because it does involve planning and a lot of patience from the patient's point of view, because it's going to take some time for the swelling and everything to subside. But it's quite a popular treatment in Korea. There are non-surgical options as well. For example, we can use Botox to slim the muscles, for example, the width of the jaw. But if you're doing chin and jaw surgery, so be prepared to give yourself anywhere between 3 to 6 months for swelling to subside. Thank you. Things are permanent only when you actually understand not only the treatment but the aftercare and how to maintain results. So you could successfully have treated brown spots and pigmentation and freckles, but if you're going to go to some sun exposure without sunscreen on your face and kind of expose your face to the sunlight, it's going to come back and it can get worse. So I would say that there are treatments which can treat hyperpigmentation, freckles and spots, but it's more about the maintenance, which is important, and your skincare. So using the right products to help with fading hyperpigmentation, because basically freckles are an accumulation of those cells, of the dark cells. So it's good to be applying something overnight, good to be protecting from the sun and using the appropriate sunscreen in the day, and even maybe hats. So I think that everything really matters in long-term results. Thanks. Botox I don't really do for droopy eyelids. Botox can help with a slightly droopy brow, maybe, because it can give you that relaxation of the forehead. For the eyelids, I really believe that things like plasma pen came along, but I am not a big fan of that because it can lead to a little bit of hyperpigmentation spots. So you have to understand that if there's excess skin, then the treatment option will always be more surgical. And beginning to see a lot of people understanding the importance of surgery when an aesthetic medical treatment cannot help, or there's limitations with aesthetic medical treatment. So in the case of an upper eyelid, for example, you can hide the scar in the natural skin crease, so which won't be visible when you're talking and with your eyes open. Even when your eyes closed, you can see a very, very faint line, but that surgery will actually address that extra skin on your upper eyelid. But you should you should discuss with your plastic surgeon whether you would need a brow lift as well, because the brow and the eyelids are two different areas. So please keep that in mind. Thanks. So stretch marks, I believe you could be using things which have good ingredients such as the BioCare oil. You could be getting a carbon dioxide laser and RF needling or micro needling, and you should be using PRP and exosomes as well, because what we're trying to achieve is that the fact is that the dermis, the second layer of the skin, has actually been stretched out. So we're trying to restore the health of that skin and trying to create new collagen and remodel the collagen so that the stretch marks are more look more faded out. So they might not be able to go 100%, but I've really seen good results with these modalities such as microneedling, carbon dioxide resurfacing with PRP, and the appropriate skincare as well. Thank you. Acne, we have to understand what acne prone skin is. If your skin is acne prone, that means you will always have a risk of purge, or you'll always have a risk of getting infections. You're always at a risk of getting scarring and blemishes. So I'm more of an advocate of skin health management. So you should be using products which are appropriate for the skin. One of the examples are niacinamide, which is good for pore skin health. But if you're overdoing things, if you are over exfoliating, so even things like salicylic acid is wonderful as a face wash, but the thing is that if you are overdoing exfoliation, if you're using a very high strength tretinoin or retinol, and you're doing double exfoliation using glycolic as more acids, and you're getting aggressive treatments, your skin might get sensitized. So please understand that with acne, it's not important that you're using multiple products. You should be using a few products, and you should be discussing with your doctor how and which treatments and when are they appropriate, so that you can really have a good management of your acne and prevent blemishes and scarring in future. Absolutely. Darker parts of body could be, first of all, you should be getting a diagnosis by your doctor. They should have a look at it, because it could be that the dark areas are maybe a fungal infection or something going on in that area. Once that is clear that it's just hyperpigmentation due to sun exposure or friction or anything, allergies, post-allergies or anything, then you can use things like, there are body lotions, such as the Allure body lotion, which has depigmenting products inside it. Please be careful with not using products which contain steroids, because they're not really good for your skin in the long term. They're going to thin your skin, damage your skin. But depigmenting creams, chemical peels, lasers, combinations, they do really, really work once they're advised in a plan, and you're doing them regularly, and also protecting your body as well from the sun by using sunscreen as well, and avoiding sitting out under the sun for too long period of time. Thanks.